Audio Jungle.
We're going to start you off with a little tour of the facility so you can get a little more acquainted and understand a little bit better what it is that you're going to be doing for the first half of the morning or for the rest of the week. So follow me. We'll begin by explaining some of the diagnostic testing rooms. These rooms hold the diagnostics that you'll be performing for about an hour and a half approximately. The first of the rooms is our vitals room. So you're welcome to come on in. So the vital rooms seems like just a regular room. We're going to take your height, your weight, your temperature, your blood pressure, but where you'll begin to see the differences is that we're not just taking your blood pressure, we're actually doing a full autonomic assessment, meaning that your blood pressure will be taken on both arms while you are sitting, standing, and laying down. They begin to look for these differences because if by any chance the blood pressure differs from one side to the other, that actually could be associated to brain functionality right and left. So it's a very, very thorough autonomic assessment. Our second diagnostic testing room is our VOG. So over here, VOG stands for video oculography. So what it is, these very highly sensitive goggles that have infrared lighting on the inside. So the test will be performed in the dark. Our patients are asked to sit down and follow a target on the screen while they have the goggles on, and it will be recording their eyes. The way that the patient is able to follow the target on the screen will give doctors insight as to how they're perceiving their environment. Over here we have our right eye, and the right eye will measure vision. It determines vision and more precisely depth perception. So that's it for the VOG room. So we'll head on over to the next room, which is called our CAPS room and sacodometer room. So we have two diagnostic tests here. The first one is CAPS. CAPS stands for Comprehensive Assessment of Posture Systems. So basically what it is, it's a balance plate. And it's a balance plate that is so sensitive, it can actually feel your heartbeat through your feet. That's how sensitive it is. So the test is performed on a hard surface and on a soft surface, and with the patient's eyes open, closed, and head in various positions, sometimes even doing math and other cognitive things. We will make sure that we block out sound so that they're fully focused. This is one of our other diagnostic tests. So this is called our sacodometer. A saccade is a quick eye movement to the right to the left. So sacodometer, it's measuring your saccades. It has these teeny little cameras in here that are taking thousands of pictures per second. So what this is going to do, it's going to sit at the bridge of the person's nose like this, and it's going to shoot a red laser beam. We usually just do it on a blank wall, and so that way the person is just following this red laser beam from right to left. The beautiful thing about it is that we can determine and see where we're at, and also a goal of where we want to be, and what the doctors are going to do to get you there. So, okay. All right, so this is our exam room, and this is where the patients will have their physical exam with the doctors. At this point, they're reviewing the diagnostic test, as I mentioned, and they do perform their physical exam that our patients have actually mentioned that it's one of the most in-depth physical exams that they've ever received. So now we're gonna head over to one of our treatment rooms. So let's see, we can head on in here. So after the doctor performs the physical exam, he will customize the treatment session. During the exam, he will say, okay, this is where you're at. This is our realistic goals that we're going to set for the week, and this is going to be the plan to get you there. Now that plan is going to be completely tailored to each individual. Over here we have our SSEP. So basically what it is our SSEP, it's very light electrostimulation. It feels like a tickle. When the doctors pinpoint an area of the brain that they perhaps want to stimulate, then they will locate the nerves that connect directly with that part of the brain and just apply the very light electrostimulation. That's why sometimes some patients have it in their temple, sometimes they'll have it in their tongue, sometimes they'll have it on the bottom of their foot because they're trying to stimulate different parts of the brain. Over here we have some dots. So we call them dots casually, but they are for vestibular rehabilitation exercises. These may vary in size and shape in form. It can be any type of combination, but the thing is that every single combination, the doctor will select specifically which one is meant for you. Now we can head on over to our other treatment room. We have several equipment here that also assist with therapy. Over to your left, we have the interactive metronome. This assists the patients with timing and precision, so they'll use a clicker, right? But it will be, as I mentioned, customized to every single person. Sometimes they'll combine weights, sometimes they'll combine balance plates, so it all really depends on not just what part of the brain they wish to stimulate, but how they want to stimulate it. Now we'll go ahead and show you the relaxation room. So once our patients are here, their treatment sessions are approximately 3 times a day. So there's little breaks in between, and I really encourage them, or we want to encourage them, to just rest, relax, and avoid any type of external stimulation. So we've created a kind of a darker relaxation room where they can just hang out. So we have salt lamps, we have some chairs, we have a magnosphere, books, so that way they can recuperate in between sessions. Now, last but not least, over here we have Mark. Mark is our multi-axis rotational chair. It is one in the world. It is the only one thus far that can rotate in all 3 axes, meaning front, back, right, left, and do cartwheels at the same time. The direction and the speed to which each patient will move will all be customized by the doctor depending on what part of the brain they're wishing to stimulate. Over here we have our world map. So this is just a little fun thing that we have put up recently. And so we have little blue pins, and then we have flags. So the blue pins are our patients, and the flags are our doctors. So we have doctors that visit from different parts of the world. As here in Europe, you can see we have flags from Norway, from Sweden, pins from Finland, from Turkey, from Dubai. Over here we head down to Australia. We have New Zealand, Vanuatu. So it's really beautiful to see how patients come from all over, but ultimately we're all sharing similar stories. And we can head on back over here. And we come full circle.